Goni skill, shoulder internal rotation. Position the patient supine with the shoulder being tested in 90 degrees of shoulder abduction. Place the forearm perpendicular to the supporting surface and in 0 degrees of supination and pronation so that the palm faces the feet. Rest the full length of the humerus on the plinth. Place a pad or folded towel under the humerus so that the humerus is level with the acromion process and the elbow is not supported by the plinth. Remember to test the unaffected limb first. In patient-appropriate language, ask the patient to internally rotate the shoulder. Assess the distal humerus to ensure the shoulder is in 90 degrees of abduction. Internally rotate the shoulder by moving the forearm anteriorly, bringing the palm of the hand toward the floor. Maintain the shoulder in 90 degrees of abduction and the elbow in 90 degrees of flexion during the motion. Stabilize the distal humerus to maintain 90 degrees of shoulder abduction. The end of shoulder complex range of motion occurs when resistance is felt and additional motion causes flexion or rotation of the spine. Assess the infield of the joint. This is firm because of tension in the sternoclavicular joint capsule and ligaments, the costoclavicular ligament, and the rhomboid major, minor, and trapezius muscles. You are now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis of the goniometer over the olecranon process. Align the stationary arm so that it is either perpendicular or parallel with the floor. Align the movable arm with the ulna, using the ulnar styloid for reference. Ask the patient to perform internal rotation of the shoulder as done previously, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous movements of the shoulder. Read the degrees of motion on the goniometer, and then ask the patient to return the arm to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. If necessary, assist the patient back to the sitting position. Average range of motion, according to the American Association of Orthopedic Surgeons, is 70 degrees.